I'm so happy to be here. This is an incredible honor to be here at the Pond Family Day and to speak on the topic of emotional regulation and tell you about the study that we collaborated on with the Pond Network during COVID and tell you also how it overlaps with the topic of emotional regulation. Over the course of the next, 20 minutes, I hope to cover the following objectives: for people to leave with an understanding of emotional regulation and perhaps the complexities when we use a term and the multiple definitions and ways it can be measured, but most importantly, I guess, the impact of emotional regulation, imbalance in the home on young children and families. Okay. Thank you. I'm going to go through the Pond collaboration in our Stepped Care I Interact North program and give you the results of the program that have now been published. And I hope throughout the presentation today, I'm going to embed some sort of practical strategies that help with parenting for kids and maybe for you too. So I have no real potential or perceived conflicts of interest to disclose regarding the research that I'll be presenting today, but I do really want to take a moment to emphasize that all of the clinical intervention work that the I Interact North program has offered to children and families across Ontario has been supported entirely by research funding. So huge thanks to the CIHR and the specific initiatives it came out with during the COVID-19 pandemic, as well as through the philanthropy of the Gary Hurwitz Center for Brain and Mental Health and the Edwin S.H. Lee Young Center for Healthy Children. I like to begin all of my presentations, to those of you who don't know me in the audience, and that's many today. I want to give my own positionality in the approach that I have taken with this work. So all of these people behind me are represented and part of the work that I'll present today. As you can see here, I'm a white female, I'm cisgendered, able-bodied. I've had the incredible mentorship privilege of working with many of the individuals here, including leadership in Pond. I've also, who's not pictured here, worked with hundreds, if not almost thousands in the 10 years of my career, young children, parents like yourselves, who have been integral in not only informing the research questions that we've been asking and trying to answer, but also partnering in the last 5 to 10 years in the research initiatives and the knowledge translation efforts that we've done. So as Alana noted, I've been a clinical neuropsychologist at Sick Kids for about 10 years. And I've had the fortune of working in the neonatal follow-up program, and specifically with neonatal neurologists. These are specialty areas working with children who are born with significant medical conditions that have impacted brain development. Neonatal stroke, hypoxic ischemic encephalopathy, and children born extremely preterm. In my role as a clinical neuropsychologist, we do assessment, right? We like to work with young children, youth, and teens to examine how they're doing, maybe provide diagnosis that can guide interventions and school supports. But really echoed in the clinical work I was doing at the beginning of my career was the parent priorities that are often lost in that diagnostic-only focus. Recently, I came across the term diagnose and adios. I don't know if you've heard that. And we also saw a sizable minority of young children who had comorbid mental health concerns, particularly concerns that looked like ADHD on top of their early injury or their medical condition. We also saw there's huge gaps in service delivery for all children in our province, but in particular for children who couldn't access maybe traditional mental health pathways due to the comorbid medical or neurological conditions. So many of the children that I've worked with, they fare really well, and you see these amazing stories of resilience for both the child and their family. However, as I mentioned, there's a sizable minority of children who come in my office, and they look like one of these children, really not having a great time in the office and despite our best attempts, and not doing well at home, or struggling with the demands of increasing curriculum and demands at school. But importantly, I also saw the interaction, and I was fortunate to have many families be very open in sharing their own experiences as a parent. Experiences of frustration and not knowing what to do. Worries about guilt, maybe they could be doing something better or different. In 2018, we conducted our first patient-oriented research designed study. In this study, we co-designed, sat down with parents to help them, or to help us, determine what were mental health priorities and gaps in current service delivery pathways for mental health outcomes associated with early medical conditions. I chose this quote for a reason, because we're here at the hospital for sick children, not at the hospital for stressed parents. But they're one and the same. And time again, the parents that I worked with and that were part of our research studies echoed how difficult it was to ask for help for themselves as a parent, despite the reality that they were the ones raising that child. So among many priorities that they outlined in the research studies that we conducted during those years, there was a common theme of improving the child's social and emotional development and well-being. I honestly can't remember one parent that actually said, I want help with my child's emotional regulation. But it's that, that's maybe a more technical term, but the realities and how that looks is how a child is interacting in their world, whether it be at home or school, socially, emotionally. The listed barriers to services are probably, understood by everyone in the audience. And yet, I remember also, I'll share, a grant review I had when we were proposing the iInteract program and its virtual care delivery. It's like, why don't families want to come to the hospital? I mean, this is a beautiful facility. We have a beautiful facility, but the reality is it's really hard on families. It's expensive, and logistically taking time off work, balancing the needs with siblings, as well as sometimes the lack of fit that was perceived in wait lists or other programs in the community, where their unique experiences of raising a child with this comorbidity were not being heard, or if anything, valued and sometimes feared by the clinicians that they worked with. So thinking about that core need that families were looking for and they were not receiving around social and emotional well-being, what is emotional regulation? Now, I could have spent 20 minutes or longer just talking on the multiple definitions of emotional regulation and the multiple ways of assessing it clinically, assessing it from a neuropathological perspective. But for the purposes of this presentation, I wanted to boil it down in terms of understanding it. There's not one definition. And it's actually an interdisciplinary definition combining multiple disciplines. It starts at roots in philosophy, which I didn't know. Aristotle talked about the balance of emotions in optimal well-being. Psychology took it on with understanding emotions and how they connected with mental health, which led to the disciplines in the last many decades of behaviorism, cognitive, thinking about how thoughts and beliefs are related to our emotions. And finally, from neuroscience, more recently, looking at the neuromechanisms that underpin these key issues that are so impactful in day-to-day well-being for young children, families, and let's face it, everyone. So instead of presenting all the multiple definitions, I just took sort of key words that I found across the definitions for today's presentation. I chose this slide or this picture on purpose because if you probably never will see me in doing something like that. But you think about the regulation that has to happen in order to take such a feat. So if you look at definitions of emotional regulation, you're going to see how we respond to our emotions, how we might influence or be influenced on our emotions, how we manage emotions. Key insights for therapy are also how do we understand those emotions, how do we recognize them, and maybe create coping strategies for modulation. Now, I'm not going to go into a deep dive of the neuromechanisms underlying emotional regulation. We actually have Dr. Taylor in the audience who could probably speak a couple minutes on that or more. But as a neuropsychologist, I'll just say I've seen many, many, many different types of both neurodevelopmental conditions and comorbid neurological conditions and neurodevelopmental conditions. And there largely is not necessarily always a unifying mechanism. We know these interrelated terms: executive functioning, emotional regulation. Are they that different? It depends how you measure them. So I've always sort of practiced, when I work clinically with families, this idea that it's one brain, it's one child, and how your child develops, it's an intertwining of these abilities. We do know from research that the underlying limbic system and frontal lobes play a huge part in regulating emotion. But we also know from a biopsychosocial framework that the biological is only one component to consider. And it's not necessarily deterministic in of itself. We have social context and the environment in which the individual is functioning. We also have the psychological skills that the individual brings to that individual situation. Ultimately, my job, I guess, as a neuropsychologist in working with children and families is what can we do when there are concerns about a child's emotional well-being? And with children, much of the evidence based in the early years, less than 10, supports the importance of giving support to the parents. And again, I'll just digress. Sometimes it's like, which one are you treating? Are you treating the parent and you're treating the child? If you treat the parent, you are treating the child. The types of strategies that are embedded in evidence-based approaches involve all of those listed here. Behavioral strategies, modeling emotional language, helping the child label their own emotions, talking about your own emotions quite openly, helping them develop skills or cognitive strategies around dealing or reframing emotions, thinking about feelings of others and perspective taking, encouraging pretend play that also acts out these emotions. So back to the task that I had in 2019. So think about it, guys, 2019. What are we going to do? What could we do here at Sick Kids to better support the pathways for mental health support for our young children and families? Well, we didn't have a lot of money. Of course, we thought, could we develop something on our own? I was very fortunate to work with Dr. Crosby and Dr. Brendan Andrade at CAMH in the Better Behaviors program. But we didn't have a lot of finances to start something really from scratch. And why should we? So looking to the literature, there was an evidence-based virtual parenting program called iInteract, internet-based recovery following traumatic brain injury. And it was developed out of Cincinnati Children's Hospital by Dr. Sherry Wade. And Dr. Sherry Wade is one of the most humblest but incredible leaders in telepsychological interventions that was decades before the pandemic. And her program really was all about supporting parents, helping parents build their own understanding of their child, responsivity to their child, consistency in the home, and just also giving a parent that coaching support that we so often sort of want to direct immediately to the child. This program had also had evidence across randomized multi-site trials, and Dr. Wade, being as generous as she is, allowed us to pilot a very small pilot in 2019 of her program with Sick Kids families. And that leads us to the iInteract North program that you may have heard of today. It's been an interesting journey over the last 5 years since that initial pilot. And together, through co-design and feedback, we've built the iInteract North program that lives on About Kids Health in its website, but lives in our lab as a service for families and a study of the impact of parenting, coaching, and positive parenting strategies for at-risk children. And we've been able to extend it with our partnership with Pond. So it addresses many of the mental health concerns we've talked about in terms of behavioral and emotional regulation. And I emphasize again, the website has been entirely built here, and you'll see many familiar faces from our families talking about the experience and the impact and demonstrating some of the strategies and skills from the program in the actual website. So how it works is this is the website I'm mentioning that we built with families, but it's combined. It's not just here, go to a website and figure it out. It's like here, read a little bit, get a flavor, and then meet with a coach that can customize these strategies for your individual family. And the customization is key. And it is entirely virtual. So we've always been doing this through Zoom, well before the pandemic. We've had trained therapists that were skilled in giving virtual therapy prior to the pandemic. And we were able to transition to the COVID-19 pandemic and expand. So who it's for, it's ideal for children 3 to 9. We include children with neurological, medical, and neurodevelopmental conditions. And really the core is a concern about the child's emotional or behavioral, and of the concerns about the parents. Often parents want to come just for a booster session or just to have a therapist who may understand and give them some additional support. Limits on Ontario residents. I had a family show up from Trinidad the other day. And we currently are focusing our initiatives in the last year at Sick Kids, but prior to that and during the COVID years from 20 to 2023, just a few months ago, we were including PON families with ADHD and PON families of autistic children. So just to give you an overview of some of those key ingredients and the take-homes from the iInteract and what we consider kind of the main medicine that the families participate in get from the program. One of the first things is just taking a moment to watch things like a hawk, like taking that moment instead of how many times we're multitasking and getting tons and tons long lists, but watching some of your own stress levels, watching your children for behavior that you want to see more of, taking a moment to breathe, and I know that's sort of been said to death, but it is impactful. It is even taking one moment in your day. Recognizing the impact of technology. How many of us stay on screens all day? And our children during the pandemic were staying on screens the whole day. So looking for non-screen time. And then the reality that parenting is hard. I think in that compassion for us or for parents and then from therapists that, you know what, we're all going to make mistakes. We're all going to have moments where we're not our optimal parents. But getting back on some of these practices, it's okay to have those moments of doubt. Another strategy at the beginning of the program that kind of is echoed throughout is praising the opposites. You know, I work with so many dedicated parents and who are so invested in optimizing their children's outcome that they almost spend the entire time teaching and trying to make everything an academic or a learning opportunity, when the time in or just focusing on what the child is doing and what you like about that child and you don't necessarily need to correct is so pivotal in switching that perspective. And sincerely following the lead of your child, and following what they want to do when it's sort of an appropriate time, and having that regular time to build those responsivity skills, and taking that to learn what your child is like when you're not trying to teach them. And finally, in later sessions around more trickier, higher level emotional experiences, and also older children, the importance of not necessarily, punishment, but actually when things are overwhelming, me time, taking time for the youth to feel empowered that they can go and have a moment, and so can you. Making tasks more doable or tolerable, creating positive role models, including yourself. And then the idea of connecting and not correcting, right? And really just taking the moment to be with your child versus trying to fix the situation, and for them to see that as well. So as I mentioned, in 2020, I believe Evdokia generously partnered with our little project, and we had 2 very successful CHR grants. And we reflected on the data from the first year of the pandemic, when we had this sort of one-size-fits-all, 8 sessions, right? Get it all. Here, take the full dose. And we really saw the reality of the pandemic, Zoom fatigue, one size doesn't fit all. So we broke it down in a step care model based on families' feedback of what they really valued, and made those sort of meaningful chunks that could be then matched to the family's availability and also their needs. So starting with an introduction and consultation and really understanding what the family was there, it also allowed us to direct to other service pathways. In the pandemic, if those of you who knew the study, we had a podcast that was specifically just listen to a podcast, take 10 minutes and listen to a podcast about the realities of parenting. Families with higher need or preference would go on to an abbreviated session where you get that introduction into positive parenting skills. And it's not just about looking at the website. Those coaching sessions actually in vivo coach virtually over, over Zoom to help the parent and child as they're learning sort of these new skills about following the child's lead, giving consistent and good directions in the home. And then finally, again, based on presenting concerns, parents can graduate to the whole program. The results that were published just this year are outlined here, showing the benefits of even that first abbreviated step in changing and improving positive parenting in the home, as well as declines in the reported behavioral and emotional concerns that the parents had, both in intensity, but I also want to reflect too, sometimes it's not just about the intensity improving, it's also about the parents' perceptions, like no longer sort of seeing some things as a problem and being able to see that more as sort of like something to let go. I think as much as, I love numerical data or quantitative data, I have to say that one of the most proudest and things that will keep this program going is the positive feedback from so many families about the impact that it's had in their own family's life, in terms of how it's online and you can do it anytime, how the therapists have been able to find solutions for the unique needs that each family has brought, and really families feeling more empowered to manage those day-to-day stresses that are inevitable and that we cannot control. So I'm just mindful of time. Where are we? Anyone? We've got 10? Okay, so there is time to listen to the parent testimonials, which are about 4 minutes.
Actually work with the doctor and doing it together, getting that kind of personal coaching where we could model back the things that we were learning and get feedback in the moment about them.
That is like one of the best things that we actually like the most of this actually, because we live far away from sick kids, so it's kind of difficult for us to actually come for so many appointments.
The online format is very helpful, and the schedule and flexibility was a huge bonus of this program. Having the opportunity to do evenings and weekends and watch the sessions when we could, that was really, really helpful.
There's a whole range of what's been going on for kiddo medically. There's speech and there's developmental milestones have been coming, but very slowly in terms of gross motor and those things. And we also find his emotional regulation is a struggle.
We didn't understand how to deal with our son's aggression.
Things used to happen on a daily basis, and she used to throw a tantrum and be very angry.
Sometimes with this sort of brain injury, if you want to call it, like processing time can be a bit longer.
The good thing is that we have help and have you guys, and that's amazing. So
we enjoyed it. Lane really enjoyed it, and the premise of it, and the playtime, and I felt that it was a good progression. Starting with the playtime and moving up to asking more, like leading the child type thing. So
I think other CHD families will find this program helpful.
There's so many families where this, I feel, would be so helpful for them as well. With some parents with limited coping skills, limited, resources and supports, and I just feel that this is something that would really help them. And then the methodology of it too. It's hard for us to get some parents out of the house and doing things.
I'm eternally grateful to the program because every time it's normal, from what I've learned, to slip up and to go back to some of our old ways of maybe yelling too much and punishing her in a way that doesn't work for her. So the program is always there to refresh and to go back over the tried skills. And I realized that it really did work well for her, and it made our home more peaceful, and it's a work in progress.
So to date, this program through research funding has been offered to over 300 families, and we've completed, this actually just got updated for today's presentation, 722 separate sessions. The infrastructure in our program can reach out to families within days and often pair them to therapists within weeks. I'm incredibly proud also of the legacy in terms of the training that the program has offered in virtual care and positive parenting strategies for young early career psychologists, neuropsychologists, social workers, in training 20 therapists, not including myself. And because it's virtual, we've been able to reach families all across the province, from as close as 2 kilometers away to over 1,300 kilometers. We also have increasing representation of diversity and careful custom tailoring of the program to help understand whether a family's cultural, religion, race impacts their family and their parenting, and how we can be sensitive and adapt the program to each unique family's needs. We're at a critical juncture, and we were very fortunate to receive a grant to take this program and test an implementation framework. The goal of implementation is to take a program like iInteract North, which has been funded through research, into clinical practice, from bench to bedside, truly. It's an incredible adventure that I'm really fortunate to partner across major divisions of the hospital to test how pathways can be developed so the program can be accessed more equitably among families in need. And it would not have been without the support and the collaboration of the many Pond families who gave feedback in terms of the program's relevance to children with ADHD and autistic children and their needs, and how many of the parenting objectives were very similar to our medical-based populations. So now this is a common referral from our Division of Psychiatry here at Sick Kids. So this is our call to action, which you can see a quote from our CEO, Dr. Cohen, really calling on Sick Kids leadership for advocacy and exploration of external and internal funding to fund the program for long-term sustainability to ultimately reach children and families in a way that it has not before. So thank you, Pond, thank you for inviting me, and thank you for being part of this journey together. And a huge thanks to my wonderful team of therapists, as well as the many families who've been part of our work and advisory committee.
We'll have time for maybe just 2 questions while I invite Dr. Kushki down to set up her talk.
Just a question. So to get access, you have to have a referral from a pediatrician, or because as a teacher, I'm just wondering, this should be in the school system. And there should almost be collaboration with the Ministry of Education coming into with Sick Kids, because a lot of parents are desperate for something like this. So has there been any talk with the Ministry of Education to get you into the schools?
That's on our plan, this implementation grant. Of course, like we work within sort of the healthcare system, but that's an often target. We actually work with teachers. We have teachers on our advisory committee that have helped us come up with parallel information that can be given to teachers who are working with that child, so we're working on consistency. But it's an excellent idea to sort of consider that in terms of the long-term sustainability and scalability. But thank you for that point. Yes.
I was just wondering, what about kids who are aging out of the system at 19? And we've had parent programs like this available. He's aged out of Sick Kids and has mental health issues. What do parents, and we would like parenting support. How does that happen for these kids who are now aging out?
Well, I would actually have to say, like, stay tuned from our lab, but I think there's many transition care initiatives, and we used to have the Good to Go Here program at Sick Kids, which was integral, I think, in connecting, and there may be parallels that I would direct you to. But you're right, it's a huge gap in supporting parents. There's another thing that we have thought about in terms of an outflow from this is actually engaging graduates of the program to have check-ins, like monthly check-ins, maybe supported with a mental health worker, that would then be for our older families, like maybe for the example you're providing.